So, Dad, when men experience low testosterone, here's what I found in terms of men that are coming into the practice. They have more belly fat, right?
Yep.
A little bit. They notice a little bit more around the mid region here. They notice that they're more fatigued. They don't have the muscle strength that they used to. So they say that, hey, I'm going to the gym and I just can't lift the same amount of weight as I used to. So there might be like a reduced muscle mass. There might be obviously like bone mass might decrease too. And then also mood changes. So a lot of men experience depression or a little dysthymia, right? They just don't feel sort of as happy as they used to. And really what I've noticed, Dad, what I've seen is that libido and, erectile dysfunction, those are the things that actually go last, meaning like men don't typically have those symptoms first, but sort of end stage, that's where they start to have issues with erections and libido.
Right. And one of the most important things I saw as a heart specialist when I was seeing men on a day-to-day basis was a syndrome of insulin resistance.
Yes.
It's amazing. These men came in, they weren't diabetic, but they would, I would see a lot of my men once a year, twice a year. And over time, I would notice they were getting more weight gain around the middle. And when a man approaches that, 39-inch waistline, so to speak, they got to be, privy to the fact that, I could be getting insulin resistance. And what happens in a lot of these men is that they gain weight, they get that abdominal girth, their HDLs go down, their triglycerides go up, their hemoglobin A1Cs start to climb very, very slowly. And now they have a second syndrome. Not only is it low T that's, crashing in on them, but now they have the syndrome of insulin resistance. So a good internist or a good cardiologist can recognize those really subtle findings, do the appropriate lab work, and, they can make the diagnosis.
And Dad, where is the chicken and the egg there in terms of testosterone? Are we talking that testosterone sort of leading to these changes that you just mentioned, or these changes are thus, and something else in the environment per se, which we're going to talk about, is decreasing the testosterone level?
It could be all of the above. I mean, one of the things that I'm really privy to, because I've been into this EMF movement for, 15 years now. Yep. And when I was lecturing, across the country and even in Western Europe 10 years ago, when I was lecturing on basically the environment and what the environment was doing to mitochondrial function and what it was doing to the neuroendocrine system as well as the lymphatic system. And it was just incredible. But what I was seeing, and I put together a lot of slides on this, was that electromagnetics was a big factor in the reduction of testosterone in men. Let's face it, low T is a big problem in testosterone. Now, look, the elephant in the living room is this. It's basically male sterility. This is a big problem.